Hey, Future Medics, Tina here, your medic mentor, and today we're talking about a medication that is going to be important for keeping your patients comfortable, but keeping you from getting vomit on your uniform. It's Zofran, and the generic name is Ondansetron. Zofran is an antiemetic that works by blocking serotonin receptors, specifically the 5-HT3 receptor. Now, serotonin plays a very large role in nausea and vomiting, specifically after chemo and in motion sickness, but it also shows up in other forms of nausea. So by blocking those serotonin receptors in the brain and the GI tract, we can help curb the urge to need to vomit. In EMS, we give Zofran for nausea and vomiting, or to prevent nausea and vomiting. So maybe you have a patient who has really bad motion sickness, and we're about to start transporting backwards in the back of a pickup truck. It's so bouncy in the back of an ambulance if you've never been back there. It's turbulent, okay? So we can go ahead and give them Zofran to prevent any nausea. But also, if you're going to give a medication that is known to upset someone's stomach, we can go ahead and give Zofran. Morphine is the best known for this one. Morphine will upset your stomach. So it's common to see the two given together and one after the other. Maybe you give Zofran and then you give morphine, or maybe you give morphine and then you give Zofran, but they couple together very well because that morphine is hard on your stomach. So we'll give Zofran as a preventative in that nature. The dose is 4 to 8 milligrams. This can be given IV, IO, IM, or PO. And we're going to see a new one here. It's called ODT, orally disintegrating tablet. So you're going to put the small tablet on or underneath their tongue, and it will disintegrate. So they're not going to swallow it. It's going to dissolve in the mouth. Because it's still buccal, right? It's still in the mouth. This is still an oral route. Now, a good way to remember that one, it's orally disintegrating tablet, ODT, is on the tongue. On the tongue. That's the stupidest thing I'm ever going to tell you, and you will never forget it. It goes on the tongue, and it'll dissolve. Onset is really fast, about 5 to 15 minutes, and patients tolerate this medication really well, but there are some side effects you need to watch for. You can see dizziness, you can see headaches, but the big one is it can prolong that QT interval. So you're going to want to do a 12 lead before you give this and keep a very close eye on that. Contraindications are also going to follow that QT interval, okay? If they already have a prolonged QT interval, you're going to learn about it in cardiology. I need you to just memorize it, okay? You're going to learn about it. If they already have that prolongation or they're on medications that will cause that prolongation, they cannot have this medication. Give them Phenergan instead. They cannot have Zofran, okay? The other one is just known hypersensitivity. So if you know they're allergic to it, don't give it. But you knew that. Here's your takeaway. Zofran is your go-to for nausea and vomiting. It's relatively safe. You just need to watch that cardiac monitor and keep an eye on any patients you know are prone to dysrhythmias. Otherwise, pretty easy to use, pretty easy to monitor. That's another one knocked out. You're doing so good with this series, you're going to be ready for paramedic school before you know it. I'll see you for the next one.